Hello, Mummy, Daddy, Grandma, and Grandpa. Good afternoon. I'm Dr. Hwang Yee Chern, Paediatrician and Neonatologist at Island Hospital. The world is fighting the COVID-19 pandemic. We, the Penangite and Malaysians, are at war too. We have been under movement control order since 18th of March. Now, in our 10th week of MCO, we have gone through a lot. We are tired of staying at home, fed up with having to work from home and having to look after the children at the same time. On top of that, we are a lot poorer financially. But it is worth it because we have gained grounds in controlling the spread of the disease. However, I'm sure you're still concerned and worried about your loved ones, especially now with a more relaxed conditional MCO. New situations and therefore new questions might have cropped up. This has been reflected by the many relevant and good questions that you have sent me for the talk this afternoon. Thank you very much to you for that. Hopefully, I can help you answer some of your queries and allay your anxiety this afternoon. What is COVID-19? COVID. CO stands for corona. VI stands for virus. D stands for disease. 19 because it starts in the year 2019. It is a disease that is caused by a small RNA virus from a family called corona. It cannot survive for a long time outside a living cell and needs to get into us to multiply. How do we know whether or not a person might have COVID infection? The symptoms that we might have to look out for is if they have fever, if they have headache, they have pain and ache in the body, they can cough, and it is important to realize initially the cough is actually a dry cough, and then they can also have wheeze. Out of that, about a third of them will have pneumonia. That means inflammation of the lung tissue. When they have pneumonia, they will be more sick, the fever will be more high grade, and the cough will be more productive. That means they can produce a lot of phlegm. So, is your child at risk of COVID in Malaysia? Let's look at our Malaysian figure. The Malaysian pediatric COVID figure as of 16th of May 2020, out of a total of 6,800 or so, only about 4.6% of those affected is happens in children less than 12 years old. Out of that, 7% of them are very young children less than 1 year old, 35% less than 4 years old, 65% between 4 to 12 years old. So what does that mean? It means that we know the Malaysian children are affected, but only a small percentage. Luckily, most of them are relatively well with only flu-like symptoms and none needed ventilation or needing the machine to help with the breathing. So far, none of the affected children in Malaysia have died. Actually, in the whole, less than 20 children, as far as we know, in the world has died from the disease. But of course, the children can also be asymptomatic carrier, which means the children themselves are very well, but they can have the potential of spreading it to other people, especially those who are older, who are more vulnerable. For example, the grandparents. What is this new potentially fatal disease associated with COVID-19 in children? From overseas experience, this is a condition called PIMS-TS. Oh, it is a very long name. You don't really need to know. But you just need to know that it stands for Pediatric Inflammatory Multisystem Syndrome, temporarily associated with SARS-CoV-2. It is actually a cross between Kawasaki disease and toxic shock syndrome. This is where the body's immune system, instead of fighting bacteria and viruses, it actually turns against our cells and attack our own organs. It can happen days, weeks, or even months after recovering from COVID-19. How do they present? They can have a Kawasaki-like disease, whereby they can have high swinging fever lasting more than 5 days, conjunctivitis or red eyes, red and cracked lips, strawberry tongue, swelling of the fingers and feet. Most dangerously, the blood vessels supplying oxygen and blood to the heart muscle can become abnormal and it can enlarge, and that can lead to heart failure and heart attack. This condition, unfortunately, is potentially fatal. But I'm very glad to say that luckily in Malaysia, we do not have any cases yet. But we always have to be vigilant. How can I protect my child from COVID-19 infection? This is a question that I have received from my international patient. Bapak Rosan, selamat petang Bapak. Terima kasih ha. Christopher Joshua bagaimana? Dia baik tak? Okay, so hari ini I will try to answer some of the questions that you have asked me. So, we know that almost all the children got the infection from affected adult household contact. Therefore, to keep our children safe, we must keep ourselves safe. When the children reach home from work or outside, they must shower, change their clothes, or at least wash their hands before they touch and come into contact with their children. The ways to reduce risk of getting COVID-19 is based on how this infection is being transmitted. It is transmitted in two main ways. First one is human-to-human transmission. Second one is direct contact with infectious secretions on contaminated surface. That is the reason why we actually, have to teach our children how to behave in certain way to reduce the infection. When an infected person coughs or sneezes, the droplets that might, contain virus can travel up to 6 feet or 1.8 meter before it drops to the ground. In other words, if a person were to be in direct line within that distance of the infected person, he may catch the virus. So that is why social distancing, the 6 feet rule, is being advised. We also think that the exposure time is important, but we are not 100% sure how long it should be. We suspect anything less than 15 minutes is not significant. Another way by which it can be transmitted is by direct contact with infectious secretion on contaminated surface. That means if the virus is on any surfaces, if we were to touch this contaminated surface and use our hand to touch our mouth, eyes, and nose, then we might the virus might get into us. That is the reason why we always advise frequent hand washing and also disinfect high touch surfaces. Okay, so I have a question from Puan Mina. She says, I'm a young mother and I have a baby aged 6 months. My baby has started eating. Very important for my baby to eat 3 times a day. Should I feed her until she's full? My baby is still not sitting. Should I worry? How to improve her motor skill? Okay, 6 months old baby. Yes, we should start to give them solid. It is not enough just to depend on breast milk or just infant formula to sustain their growth at 6 months old. Solid is important. Initially, it doesn't have to be 3 times a day. You can actually feed the baby once and then slowly increase to 3 times a day. If your baby is not sitting up yet, you might want to try to put her on a high chair with some cushion support to try to get her used to the idea of sitting. By 7 to 8 months old, your child should be able to sit temporarily. If your child is still not sitting, please bring your child to see a pediatrician by the time she's 9 months old. How can I then protect? Is there any other ways I can protect my child from COVID-19 infection? Yes, frequently washing your hands. You do it by example, and you can teach the children all the correct technique in a very fun way, for example, by songs or by dance. How do we do it properly, hand washing? First and foremost, you wet your hands thoroughly and then apply enough soap to cover the whole hand. You must wash the whole of your hands, in not only just the palm, you must include the back of your hand, in between the fingers, the back of the nails. And then after that, you must rinse thoroughly with running water. What is important to stress is the rubbing of all the surfaces has to last at least 20 seconds. 20 seconds is actually a long time. You might not realize it. Actually, it's the time needed to sing happy birthday songs twice. After that, you then rinse your hand thoroughly with running water. It is then followed by drying of the hand with a clean cloth or a single-use towel or tissue. You must wash your hands often before and after eating, especially after blowing your nose or coughing or sneezing, because there might be contamination of your hand with all the infected secretion. After you've gone to the bathroom, you must wash your hands as well. Studies have shown that if you can wash your hand up to 5 times a day, you can cut down medical visits for breathing difficulty or infection by 45 minutes. So it is definitely worth it to wash your hands frequently. Of course, the mainstay is water and soap. But if water and soap and washing facilities is not easily or readily available, some alcohol-based hand sanitizer will do. But it must contain at least 60% of alcohol, 0.1% of hydrogen peroxide, or 0.1% of sodium hypochlorite. Of course, if your children or your hand is visibly dirty, it is more important to then wash with soap and water. Another thing that we can do to cut down the risk of transmission is to teach the children the correct coughing and sneezing technique. For example, when you cough or sneeze, it is important to cover your mouth and your nose, both mouth and nose, with both hands. And then after that, wash your hands. Alternatively, if a tissue paper is available, you can use the tissue paper and cover, and after sneezing and coughing, throw the tissue paper away. However, if your hands are preoccupied and you cannot use your hands to cover your nose and your mouth, what you can do is you cough into your sleeve or cough into your elbow. By doing so, you're protecting other people from catching, your secretion. Of course, you must teach your children by example. You show them how to do it, and then they will follow you automatically. Screening is also very important. This is because you can then detect potentially infected person and try not to be near the potentially infected person. Screening can be done by checking their temperature regularly, by a no-touch thermometer, or screening can be done by asking the history of personal contact with anybody who is infected or history of that person being unwell. Wearing of mask is important because it can provide a source control. That means blocking the spread of your droplet from an infected person who might have active infection without their realizing it as well. So, what is most important is this culture of accepting that we have to have new ways of practicing, we must have new rules, and we do not feel embarrassed to practice that. All these activities and all these behaviors is a combination therapy. It is like a drug cocktail. Every maneuver and every behavior on its own is not effective, but all joined up together, combined together, will make it a very powerful tool. This is like baking a cake. Individual ingredients that is not tasty. However, when you put everything together, then you can bake and enjoy a very delicious cake. Another question that has been put forward is there any COVID-19 test available for children? Yes, All the tests available for adults are also available for the children. These tests are mainly of two main categories. One is through the nose and throat swab. The other one is blood test. It is actually not so easy to do nose swab or throat swab on young children, and special expertise and training is needed. So it has to be done it can only be done and should only be done in specialized center. Some parents actually ask, how do I talk to my children about COVID-19 without how do I talk to the children about this disease without frightening them at the same time? Yes, this has to be done, but it has to be done with a very delicate balance. Children are very sensitive emotionally. They can sense it when the adults are worried too. They might be afraid and feel awkward to wear the face mask as well. For children less than 3 years old, it is best to explain or answer their questions in simple language that they understand. For example, if the children ask, why do we have to wear face masks? The parents can explain by saying, people wear face masks when they are sick. And when they're better, we can remove and stop wearing the face mask. Or you can tell them, we wear the face mask to stop ourselves from being sick. For older children older than 3 years old, we can focus on germs or the bad guys or the bad bugs. We can explain that germs are special to your own body, and we need to make sure that our germs stay with us and we don't pass it to our good friends or our family. The mask can then help keep our germs to ourselves. The mask will also help us to protect other people's bad germs from entering ourselves and make us sick. Meanwhile, it is also very important to reassure the children and emphasize that you are very confident that if they do whatever you tell them to do, they will stay healthy and safe. Sometimes the children might not want to wear the face mask because they feel very uncomfortable and awkward. So what you can do is you can start wearing face masks and show them that it's okay. Even your mommy and daddy are wearing face masks and walk around the house. What you can also do is let them wear the face mask on their favorite toys, on their favorite doll, or their favorite teddy bear. And then you can see, hey, teddy bear is also wearing face mask. So it's okay if you wear face mask at the same time. Alternatively, you can also make them feel more comfortable by making them draw on the face mask. You can put superhero figures, on the face mask, or you can show them photos of their favorite celebrities wearing face masks. Superman wearing face masks, Spider-Man wearing face masks. Another question is, what is the correct type of face mask for my baby who is less than 2 years old? The answer is, children less than 2 years old should not wear any face mask nor any face shield. Why? Because face masks and face shields in less than 2 years old can cause more harm than benefit. Even in you and I, the adults, sometimes we do have difficulty in breathing when we are wearing face masks and we just feel like taking it off, let alone the children. If the children were to have breathing difficulty, they might not have the capability to remove the face mask, especially if they are young, less than 2 years old, or if they are children with special need. So that means there is a risk of suffocation if they were to wear face masks. Especially newborn babies and infants. Their lungs are very immature and their breathing process is very delicate. Any disturbances in the airflow can cause build-up of carbon dioxide and lack of oxygen. So it is not safe. If you really want to protect your child, what you can do is you can actually put a breathable, thin cloth over the baby's car seat carrier, or even pushchair, of course, with the baby in it. If you are carrying the baby, you can also put a similar cloth, a thin breathable cloth over the baby. So in that way, you can give your young babies, some protection. So what type of face mask is suitable for kids older than 2 years old? For a face mask to be effective, it has to fit the child's smaller face snugly. A study in Nature shows that a fitting face mask, when worn properly, can be used as a source control. It can block between 75 to 99% of the respiratory droplets, especially if they are infected with any viruses. Sometimes a child-sized face mask might not be available. When that happens, we must and we can modify it using adult face mask by folding it. So what you can do is, this is an adult size face mask. What you can do is, you can tie a knot here. You can tie a knot. Tie a knot and tie the knot there. Fold into half. Yeah. And so you bend here to create the nose bridge for the child. And then on the sides, you actually fold it inwards into a triangular shape like that. On both sides, fold it into a triangular shapes on both sides. Okay? And then, hooray! A child size face mask is available, and then the child can wear it. Okay? Now sometimes the nose bridge might be too big for the child. So what you can do is you can use a tissue paper, fold it into half, and again, and then put it under the nose bridge and wear it so. This is not only useful for children, it is also useful for people like me who wear glasses. This is because the tissue paper can block the steam from the nose so that our glasses does not steam up. Okay? And then sometimes you see children. Sometimes you actually see children wearing a bigger size face mask. And then what you can happen is they can actually, they can, okay, what happened is you can see them doing this. You can see them doing this, like that, to try to make it tighter fitting. But this is no good. You know why? You can see by doing that, this is actually bunched up there. Okay, see, there is an opening here, which means air can go into the nose and the mouth, and if it is the air with infected with viruses, it can go through. So this is not effective. What is actually more effective is if you were to tie a knot here, so tie a knot here and another knot here, and then when you wear it, you can see there's a nicer seal. Okay. Let's see the next question. Okay. Some parents ask, is there a difference between homemade masks and surgical masks? Homemade masks are usually double-layer cotton cloth masks. Cloth masks are not as breathable as surgical masks. Therefore, surgical masks are about 3 times more effective than homemade masks. However, as surgical masks are in short supply nowadays, so you might not be able to get surgical masks. Cloth mask is therefore better than no mask. Let's see any other questions. Oh, thank you very much, Kate Shearer. Yeah, I hope you can use that method to encourage your own child and your friends' children to wear face masks? Another, as I mentioned earlier on, now with our conditional MCO, people are talking about sending, parents have to go back to work, and therefore they have to think about whole childcare for their babies and for their children. So they start to ask, is it safe to send children back to nursery, kindergarten, and school? Whether or not it is safe depends on two main factors. It is only safe when the local transmission rate or the infectivity rate is low. It is only safe if the school, childcare, or preschool, whatever facilities, has a good COVID-19 infection control policy and practices. What do I mean by low local transmission or infectivity rate? It means that not many people in the community is harboring the infection. So the chance of getting it from the community or from your fellow classmate is relatively low, especially if you take necessary precaution. In Penang, for example, we do not have new COVID cases since the 27th of April, and we are certified as green zone since 10th of May. Therefore, it is relatively safe to normalize, which means going back to work, nursery, preschool, and school, but I must stress with the necessary precaution. Before sending your child back to nursery or whatever facilities, there are certain checklists of precaution that you should look out for before you decide whether or not the facility is safe. What are they? What are the good infection control practices? On arrival at school, all children and staff should be screened. They should be screened for temperature using non-touch infrared thermometer. They should be screened by history taking to detect personal symptoms of illnesses like cough, runny nose, lethargy, and also history of contact with sick people. Children older than 2 years old must wear face masks. You must also check and see whether hygienic measures are being practiced inside the facilities, whether or not they have been taught to the children. And there are frequent hand washing upon arrival, hand wash after going to the toilet, before and after the snack time or meal time, after returning from outdoor play, and before going home. And sometimes soap and water might not be available. You must also make sure that hand sanitizer is readily available. Young children, it is not possible for them to adhere to social distancing, but we can do modified safe distancing. How can we do that? We can do that by reducing the number of children in a classroom. In that way, they have more space to run around and the distance between the children are automatically increased. Each class must act like an isolated social unit, which means they come to school at a staggered time. They come to school at a different time and go home at a different time. There is no mixing or meeting of the different classes. In the past, they might have their meals in the main dining area with all the other children. Now, they must have their meal in their own classroom and they don't go out anymore. Even when they go outside to play in the play area, they must take turns to go. Even if they go out together, the playground has to be demarcated and designated so that they don't mix with each other. No parents and visitors are allowed inside the school as well. It has been known that air condition spread coronavirus. Therefore, we must be very careful with the air circulation inside the facility that we send our children. Ideally, all the rooms should not be aircon. Ideally, all the windows should be open with a fan to improve air circulation. But if it is too hot and you need to put the child in an air-conditioned room, you can consider opening the window partially to allow for certain amount of air circulation. The facility must also be very careful about providing clean indoor environment. For example, taking off of shoes before going into the classroom, they only wear non-slip indoor socks. Toys and surfaces are being disinfected regularly. Toys will be washed with water and soap daily, and then after that dried under the sun. If toys cannot be washed, maybe they can use disinfectant, appropriate disinfectant to wipe out, to wipe clean. Of course, all toilets should be disinfected at least 2 to 3 times per day. Knobs, frequently touched surfaces must be cleaned and disinfected as well. What is most important is the facility must have a culture where everyone is in unison and that they have the same attitude of walking the extra mile to protect one another. For example, it is not a hassle for the parents to let the child wear face masks from home, and it is not a hassle for the parent to agree to have an extra face mask in the bag so that if the current face mask is dirty or wet, they can change it. It must also be acceptable for the parents to have a clean set of clothing or uniform in the child's bag so that as soon as they arrive in the school, they change into the clean uniform so that they do not bring germs from the home to their classmates in the school. So if all these things are being taken care of, I would imagine the risk of going back to school or nursery or kindergarten is relatively low. Many parents call me up and say, Dr. Hwang, can I come for my child's vaccination until the pandemic is over? My answer is, the pandemic will not end in the near future. It will not be a matter of weeks. It might be months, unfortunately. One of the theories that children do not get it so badly is that children are more immunologically active. Don't know why, either from the frequent respiratory infection that they pass from one to another at school or nursery, or it could be from all the frequent childhood vaccination that they receive. Furthermore, we also know that all infections, especially influenza, can reduce our own immunity and resistance. And when that happens, it predisposes us to any infection, especially COVID. So, vaccines are immune booster. So, vaccination is important at all times, especially now. So, please vaccinate your children. Another question that they ask me is it safer for me to take my children to the clinic or a hospital-based clinic for vaccination? Is it safe for me to take them to see the doctor when they are not well? In my opinion, whether it is hospital-based clinic or outside clinic is not important. The important issue is whether or not the facility is vigilant and take special precaution to screen all patients to reduce the risk of COVID exposure. Say, for example, in Island Hospital, upon arrival, and there is only one entrance into the hospital. Upon arrival, our body temperature is taken on all patients and staff. All patients have to answer a travel questionnaire. And if they are found to have any symptoms of chest infection, cough, or runny nose or fever, they will be isolated straight away. Immediate diagnostic tests will be done, and if they are found to be positive, they will then be transferred to special designated COVID hospital in proper designated isolation procedure. In that way, we are making sure that the risk of coming to the hospital is very low. Now, when you are in the clinic, before you go to the clinic, it is better that you call up for appointment. By doing that, we are reducing the number of people waiting outside and queuing up. And then we can actually provide social distancing. When your child is in the clinic, encourage them not to play in the play area. If they cannot help it and they have touched certain toys or they have gone into the playground, make sure that they wash their hands first before they touch their mouth, eyes, and nose. If you have no facilities to wash their hands, get a pair of clean gloves and let them wear until they reach home, and after that you can wash their hands. Of course, when they reach home, take a shower and change into clean clothes. Another very commonly asked question is, how do I boost the immune system of my kids to prevent germs and viruses? Unfortunately, there is still no cure or treatment or vaccine for COVID-19 yet. Therefore, the best way to fight it is to build our own body's defense. Please don't spend lots of money buying special vitamins, special supplements. None is found to be effective. How can we build our own body's defense? This can be done through good nutrition, balanced diet, exercise, enough sleep, and vaccinations. Make sure that your diet is as natural as possible. Make sure that there's no processed or tin food, no preservatives in your diet or in your child's diet, no processed sugar. Make sure that you let them eat lots of fresh vegetables, fruits, and drink plenty of water. Another thing is, now that everybody is at home with reduced activity, please avoid overeating. Eat until you're not hungry. Don't eat until you're full. Eat until only 80% full. Another thing I want to stress is, as mentioned earlier on, up to 7% of our pediatric cases are young children less than 1 year old. So it is very important to stress that mothers should try to breastfeed their children until they are at least 2 years old. This is because breast milk contains a lot of antibacterial antibodies, antiviral antibodies, and all the immunologically active goodies and cells that is produced by the mother and can be passed from mother to child through the breast milk. Yes, all of us realize it. It is not easy to take care, entertain, and educate our children at home. But the bright side is, this is the best time to educate them on hygienic practices and good health. It is also a good opportunity where the family can spend quality time together without interruption. It is economically expensive to have movement control order for the nation, but it has to be done. It has to be done to flatten the infective curve and to break the chain of transmission. Parents, Penangites, and Malaysians, and of course our friends from overseas. With our united effort and maybe some help from medical professions, if necessary, I'm sure we can win the war against COVID-19. Please stay at home so that we can stop the virus and save lives. Thank you very much for joining us this afternoon. See you soon.